Good afternoon. Today is Friday, March 15th, about 4:15, and this is the second voting session for the day with the Finance Committee. You're not David. Nathan, do you want to go over bill number 473?
Happy to. So as amended and shown in the reprint before you, reflecting amendments that are offered by the chair, Senate Bill 473 is an administration bill establishing the Pavla-Pair Innovation, or PLI, Acceleration Grant Program and the Baltimore Innovation Initiative, or BII, pilot program. So both of these programs are administered by TEDCO and provide funding for certain technology startup companies. Each fiscal year, the governor must include an appropriation for PLI in the budget, though no amount is specified. In fiscal 25 and 26, the governor must include an appropriation of 1.5 million for the BII pilot program. Eligible universities must contribute up to $50,000 annually to be able to participate in the pilot program. The $1 million annual mandated appropriation for the Business Telework Assistance Grant Program is repealed. The BII program terminates after 3 years. So the amendments limit eligibility for the Pavla-Pair Innovation Acceleration Grant Program to startup companies founded by students, alters the fee that an institution of higher education must pay to participate in the BII pilot program, and makes technical corrections. There was no opposition at the hearing. The budget currently includes $500,000 for the LaPair program and 1.5 million for the BII program. The amendments align the bill with the House bill.
It got stuck in budget and tax. They were approving it. We didn't get the message back. So that's what we found out today. Thanks to Mindy, we followed up on it and found that out.
2 against. Okay.
So
Favorable.
do I have a second? Second, all in favor of the Pavla-Pair Legacy Innovation Act? Is it unanimous? Senator? Okay. 1, 2, 3, 4, 5, 6. Thank you. Do the which one do you want to do next?
Do you want to get to the easy one or the?
And we can do the easy one first.
Okay, the second bill on, or the last bill on the list, we'll take that one first, is Senate Bill 1071. This was heard yesterday, and it's a cross file to a House bill that's been worked out with no opposition. Similar to what you just enacted or passed a little while ago regarding sepsis. This requires hospitals to establish and maintain protocols and capacity to provide appropriate evidence-based interventions that reduce the risk of subsequent harm and fatality following an opioid-related overdose before discharging a patient. It also allows the patient to possess at least one, or the hospital to possess at least one formulation of certain medication-assisted treatment. The bill's introduced, created a whole series of things they had to do. This reduces it to one. And to treat a patient who presents in a hospital emergency department for opioid-related overdoses rather than just treatment. There's 3 amendments to the bill. The first one is technical. The second one alters some definitions, and it clarifies that the bill applies to visits to a hospital for an opioid-related emergency medical condition rather than just somebody coming in for treatment. It strikes the requirement that a hospital dispense, administer, and prescribe medication-assisted treatment. Requires a protocol established by a hospital to use certain uniform practices for screening, which is the basis of the bill, and requires a hospital to make referrals and to work with peer support professionals before discharging patients diagnosed with opioid use disorders. The bill came in and created a grant from the Opioid Restitution Fund to provide assistance to hospitals to implement the bill. That is struck from the bill, and instead there is a study trying to figure out how to best use opioid restitution funds to provide training and resources to implement the bill. So the requirement for diversion of opioid use funds is struck, and they have to study how they can use these funds. And this bill is moving out of the House, or might be out of the House already, in the same posture.
And there was no opposition.
There was no, as amended, there's no opposition to the bill.
Favorable.
Second, all in favor of Senate Bill 1071? You like it?
I like it.
Unanimous. We have now been joined by Senator Washington, so we have 9-0. Okay,
Okay, we'll go to the middle bill. This is the bill that was discussed at the last voting session that is now before you. We heard back from the health department and they have suggestions, which is in the bill, the amended bill in front of you, and they're leaving it, we can go straight to the reprint. They're fine with strike, if you recall, Senator Lamb's amendments strike specific requirement for screening for Krabbe leukodystrophy. And instead, there's some changes made on page, which I can't get to right here. Should be the third page. There it goes. At the top, the bill is amended with the amendments here, sort of remove the role of the state screening panel or the state advisory panel, and just says that if the U.S. Department of Health and Services recommend uniform screening, if they make a recommendation, the state has to take action. The department has no position on that. That's a policy call for you all to decide whether you want to remove that role from the advisory panel. The amendments offered by Senator Lamb would have required any core condition to be screened for in 18 months. The department is requesting you go to 2 years instead of 18 months. And then finally, if you go to the last page of the reprint, they are suggesting, actually, if you go to the page before that, they would prefer that, did I get these amendments right?
I don't know, I've got an awful lot of.
Okay. If you go to the bottom, page 4, they were section 2, they would prefer 2 years. Once the Fed says it's okay to screen or gives the approval to screen for Krabbe dystrophy, the bill said 1 year after their issues their recommendation. The department suggested it would be within 2 years to allow for them to procure the proper equipment to do this. And they're not a big fan of the 3-month report, so that's not in here anymore. Again, this is their suggestions. It's up to you all to decide what direction you want to go with this. But this is what the department would prefer.
Senator Hershey.
Thank you, Madam Chair. So we had this language previously on another newborn screening bill, and we went back and forth with the Department of Health on it. And this is the language that they came back. They wanted their 2 years. I mean, 3 years ago, we made a policy decision to say if this type of testing is available for newborns, that we want it to be implemented as soon as federal government says it can be implemented. And I think what we had in the language was that it had to be done within a year. And then the reporting language at the back, which was just struck, came back and said, if they can't do it within a year, then they had to come back and say that. So I would rather keep it the way that it was. And, again, let's be consistent with what we've done in the past. And if the FDA, I guess it was the FDA, if they came back and said that this was
It's not the FDA.
I'm sorry.
It's a federal panel.
Federal. That's what I meant, federal. I just would think that we should be consistent with what we've done previously. So. Thank
Senator
you.
Lamb.
Yeah, and so to follow up on Senator Hershey's point, I think what is in here is actually stronger. It actually moves the ball forward on what Senator Hershey started from a couple of years ago. Because I think we heard testimony where it's a two-step process, right? So the federal government has an advisory panel called RUSP that makes a recommendation. Then the state has our own advisory panel where they're going to sit there and decide, do we accept the federal recommendation or not? That's step one. And then step two is the implementation. And so I think under the bill that a couple of years ago, Senator Hershey sponsored and passed into statute, which is existing law, it says that in step one, the state advisory committee has to review any federal guidelines that come down and accept them. And if they don't, then they have to report back annually to us. What this version does now is actually removes that step. So it eliminates the need to have to go through an approval process at the state level, because if you look back historically, the State Advisory Committee has never accepted the federal recommendation. So it seems like an unnecessary step there. And so this version as drafted goes further and builds on what Senator Hershey had started a couple of years ago by saying, well, let's just cut out that first step then. We don't need the approval step. Let's just say that the State Advisory Committee has to accept the federal guidelines, because all that does is delay things by another period of time. Now, what they said in the second step, which is the implementation step, they say that they want 2 years to be able to implement. The bill, I think, the bill says 1 year. The amendments I offered earlier said 18 months. And so there's a little bit of haggling there over, is it 1 year for them to implement? Is it 18 months to implement? They want 2 years. That's the version that you're seeing in this reprint here. The other significant difference here in this bill is that at the ends, in uncodified language, specifically for CRAB A, they want 2 years. And so there is a significant policy difference here, because I think the sponsor wanted 1 year, right? And I think, or maybe it was when I suggested the amendment, it was an amendment that I suggested of 1 year, to give them 1 year to figure out CRAB A, because obviously there was a lot of concern from this committee about how long it's taking for CRAB A specifically. And so I think in my earlier version said 1 year for them to implement CRAB A specifically. They're going back to 2 years here. That's a policy decision for this committee to decide. I think we ran some rough numbers based on how frequent CRAB A occurs, and just kind of looked at it epidemiologically, that the what you're talking about is probably one baby or one child not being caught. If you delay it by an extra year, based on number of babies being born, the frequency that you might see CRAB A, you're probably looking at one baby that's not being caught. If you change it from 1 year,
That could be your baby or
Yeah.
my baby, or
Exactly.
your baby.
Yeah.
it could be, yes. And so that's a policy decision for this committee. Do we want to risk that one baby that might not be caught by extending it from 1 year, which we originally proposed, to the 2 years that the department wants?
We vote for a lot of stuff.
Well, let me just add two things I remember from the hearing. One is there's an issue now with false positives that they have to go back and retest, and they said that they are trying to make a better test. So that's a reason not to push them to 1 year. But the other thing is they already know that we want this and they should already be working on it. So just kind of two sides of the issue. No decision.
To your point, they can see this train coming. They know that CRAB A is going to be added by the Federal Advisory Committee. It actually formally hasn't been recommended at the federal level yet, but that looks like it's coming in July. And so they've been seeing this already. They have had time to account for this, and and I think the July recommendations should have further information about a second screening that takes place to further reduce those false positives, because nobody wants to get news that that your baby has CRAB A and then realize later, oh, they don't, right? Because that's also lurching too. So
You took that. Figuring out.
Yeah, his amendments basically reduce or almost eliminate the role of the advisory council.
Right, you're just saying you gotta do with it. So it's
Yeah.
now just a matter of,
they've accepted.
right,
They're
good.
okay with it.
Okay, so now it's just a matter of what the time frame is.
Right.
Right.
Is it 1 year, 18 months, 2 years?
To implement.
To
So
implement the second phase, right?
do you think we could leave the 2 years in on page 3 for going forward? But because CRAB A, we've already heard so much about it, that in that uncodified language, we could change that to 1 year. I mean, that would be,
That's what it. Yeah.
everything else.
Senator Lamb's amendment was 18 months.
Oh, Senator Kramer, we're happy to hear from you.
Thank you for that, Madam Chair. Yeah, I would say my ambition would be that we minimize those amounts of time, that period, as best this committee is willing to tolerate. So I know we originally, I thought, had in Senator Lamb's, 1 year. And so I guess the department is who said they want 2 years. I would have no problem myself rejecting that and saying, let's keep it to 1 year. Cause we are the policy makers, but I don't want to do anything to cause any harm to the bill. I just want to try to make it as strong as possible to help as many families and children as we possibly can by detecting this as early on as possible.
Fortunately, it doesn't happen often. It sounds like maybe one a year. It's very sad that when it happens. So Senator Lamb, what,
Yeah, that's just crap.
just Crabbe, no, I understand. No,
This changes are affecting all newborn screening.
I understand
Right.
that, but I'm looking at the codified language for Crabbe.
Right.
Senator Lamb, let's take your recommendation. What do you think we should do?
I mean, I think my recommendation in the prior version of the amendments was 18 months, was kind of splitting the middle there. Because the bill came in at 1, they're recommending 2. We could go back to 18 months on every other condition moving forward. They do generally see what the feds are gonna do, right? So they get a sense that this is likely to happen and they can start planning for that, especially since there's not the step that takes place before of whether they need to contemplate, accepting it or not. We've removed that. They're gonna have to accept the federal guidelines. So
That's true. So you're saying 18 months on page 3 in line 8 and something, 8 and blank. 18 months instead of 2 years there.
mhm.
And then what should we do in the uncodified?
That depends on whether you want to save that one baby or not.
I say we save the baby and go to
1
1
year.
year, Madam Chair, as
Yep.
you suggested.
1 year. Can we do that? Can we get that amendment?
Yeah, his Senator Lamb's amendments are still, the other thing they requested is the 3-month updates. Do
That's
you,
fine.
you take that out?
Yeah.
Yeah.
Oh,
Okay, so then
Yeah.
the bill, the bill as amended would be Senator Lamb's amendment. And his original screening would begin 1 year and 6 months after the core condition is added by the federal panel. And for the uncodified section, they have to implement screening for Crab within 1 year after the U.S. Department of Health and Human Services issue their recommendations.
Move favorable on the amendments.
So that was, I think I heard Senator Hershey first. So Senator Kramer and Senator Hershey, all in favor of the amendments we just discussed on Senate Bill 1117, all in favor, unanimous? Thank you very much.
Right.
All right, you're all free to go. See you 5